90% of people with autoimmune disease, FYI, don't have enough stomach acid. Brenda recently just finished her program a couple weeks ago. I'd love for you to do a quick introduction and tell me a little bit about what your pain story was prior to this program.
Over 30 years ago, I started experiencing excruciating pain and went from being an athlete to not being able to go on a walk around the block
Yeah.
or go running or ride my bike or swim, the things that I did every day, because I couldn't do so because of the pain in my hips and in my knees that started literally out of the blue. That combined with other joint pain and chest pain and migraines, which I had never experienced before, I became debilitated with migraines, eventually led to a lupus diagnosis over 30 years ago. There's no cure. Prednisone was the really only answer, which wasn't an answer for me because it didn't affect me well. And so I spent the rest of my life taking Plaquenil and eventually put on Cellcept, which is a very serious organ transplant rejection medication.
Turn off your immune system.
Exactly. Fast forward to about 7 years ago, out of the blue, I was sicker than I'd ever been in my life. I had excruciating joint pain. I couldn't get out of a chair, literally could not get out of a chair without my 80-year-old father, who I lived with, helping me out of the chair. I was
Yeah.
supposed to help him out of chairs. He had to help me out of bed. I couldn't sleep at night because my hands and fingers were so swollen and in such pain. There was no position that allowed me to sleep. I remember sitting on the edge of my bed at night with my hands hanging between my knees, with my chest resting on a pillow, just crying because I couldn't get any relief. I had diabetes too. That prednisone really increased my blood sugar, which made my diabetes even worse. And ultimately, as a result of that, I developed what's called Charcot foot.
So, Brenda, 3 months ago, you were not in this program. So, what was your pain level like 3 months ago?
Before I started the program, my pain level was probably average 8 or higher on any given day.
Yeah.
I was at the end of my rope and I realized that my life was going to be drastically shortened.
Yeah. So you were dealing with lupus, the diabetes, the Charcot's foot, and the scleroderma, all of those, and that was impacting 8 out of 10 pain. So, question everybody wants to know is, this is just 3 months ago. Where are you at today with your pain level?
So today, at this moment, right now, I have zero pain. Probably any given moment, I'd say maybe a level 2.
So you went from an 8 to a level 2 pain in a matter of 3 months. And the question for you was this even imaginable that you'd be a level 2 pain 3 months ago? Did you even thought this was possible?
I hoped it was possible.
What do you think was the biggest linchpin in causing pain to go from 8 to a 2 in just such a short time frame?
It's all 5 pillars together. But for me, probably the biggest linchpins had to do with digestion, my
Digestion.
digestive issues. I had absolutely zero natural digestive ability. It had been further destroyed through all the acid blockers that my physicians had me taking.
This really is a big pain point for me and a point of like it's like a passion I want to scream from the top of the rooftops. And God, whoever's in the audience watching right now, for goodness sake, if you get nothing out of this, get it now. Digestion matters. And it is one of the major triggers of autoimmune disease and pain. And we spent a long time in the program teaching you all the concepts and pieces and the places where digestion happens and why they impact so much upon pain. At least 90% of people with autoimmune disease genetically have digestion problems, period. I'm letting you know that's data. Number two is, what did you learn in the program that really cemented to you that 100% you had digestion issues?
Every aspect of our health goes back to our ability to digest, our ability to create and maintain and also eliminate hormones, our
Yeah.
liver health, our GI health, every aspect.
Just the first step of digestion from your gut is, well, one of the first steps is stomach acid. And what you mentioned, something is really important. 90% of people with autoimmune disease, FYI, don't have enough stomach acid. That's coming in the door. Okay. Everybody listening, please, winner, winner, chicken dinner, know this fact. But number two, Brenda just mentioned something. She took years of acid blockers from her doctor for treatment of these type of heartburn type symptoms that most doctors to this day think is related with over acid production when it's the opposite. So as a result, someone already has low stomach acid, has a bunch of heartburn for a variety of reasons. I'm not going to explore it today, but there's a variety of reasons we have it. But it's not because of high stomach acid. You take these people with low stomach acid, lots of heartburn symptoms, and then you say, "Oh, I'm not going to do anything about those root causes. I'm just going to turn off your stomach acid." OMG, that literally freaking creates autoimmune disease and cancers because it completely impacts upon your whole GI tract's ability to detox, break down nutrients, absorption. It makes food allergies go up like crazy. It makes infection in your gut go crazy. Also, your digestion is what breaks down all these inflammatory factors that migrate to your muscles in your body that causes pain. So, taking proper digestive enzymes and understanding what's broken in your digestion is really important in dealing with pain.
Now, understanding that also through testing, I just don't have digestive enzymes, this is the thing that allows me to even digest the supplements that I take. I
I
couldn't
know.
even digest my pills.
Well, that was the point. Do you know how many people in the audience here is taking all these supplements that are supposed to help with A, B, C, and D? They're not even digesting it. Like, how many of you out there are taking a boatload of supplements that you think is going to help with autoimmune disease and you can't even tolerate it or it's not doing the job that it promised? Type in chat. I really would love to hear from you. And how the are you supposed to take and absorb 30 supplements a day? That's asinine. But yet that's what these people with autoimmune programs are supposedly selling you is a list of supplements that you're supposed to take all the time for the rest of your life rather than solving the underlying problem. And one of the major underlying problems is freaking digestion. What I already know and what's going to blow up in the autoimmune world in the next 5, 10 years is just how important proper digestion is to every aspect of autoimmune disease. I would love the audience to know that any of you that are dealing with pain and autoimmunity, you want help. I'm going to put a link below in the video for you to chat with our team. Go ahead and put in the comment section some details about what you're going through, and then check your message requests on Facebook, or just click the button and chat our team and tell us what's going on with you. Because I promise you, there are going to be trainings that I've done or case studies of real people that's really going to help you figure a way out of this.